But first, the original plan was for us to be joined this morning by Sajid Javid, but after the Health Secretary tested positive, a last-minute substitution was made and his colleague Robert Jenrick, the local government secretary, has come off the bench. He joins us from Birmingham. Thank you for joining us in place of your colleague this morning, Mr Jenrick, who, despite being tested positive for COVID, is now self-isolating. Let me just ask you this. We just got the statement a few minutes ago about the Prime Minister's situation. It says that the Prime Minister and Chancellor will be participating in the daily contact testing pilot to allow them to continue work from Downing Street. Now, when the Prime Minister talked about Freedom Day, did he just mean freedom for him and the Chancellor and other cabinet colleagues, and not for the millions who are supposed to go to work but won't be having access to that pilot?
Well, good morning, Trevor, and thanks for having me on the programme again. You're right to say that the Prime Minister and the Chancellor were contacted by NHS Track and Trace overnight, which shows that the system is working. They're going to take part in a daily testing pilot, which is available to a range of organisations, not just to politicians. It's being used by Border Force and by the Transport for London that runs the tube in London, for example. And that means that they can conduct important government business, but they won't be able to go out socialising or meet other friends and family. So they'll have to limit their contact with other people as much as they possibly can. But to your broader point, we do believe that we're able to move forward tomorrow with stage 4 of the roadmap. That's really for two principal reasons. The Prime Minister set two ambitious targets earlier in the year. Firstly, that we wanted to ensure that 2/3 of the adult population of the country had been double vaccinated by this point. And secondly, and just as importantly, that every adult in the whole of the United Kingdom had been offered at least one vaccination. And both of those tests have been met. So that does mean that we're able to move forward, but we'll be doing so very cautiously, Trevor, because as you note, cases are rising, hospitalisations are rising, and so we're all going to have to exercise personal responsibility and informed good judgment in the days ahead.
Can I just bring you back, Mr Jenrick, to the question I asked you, which is about this pilot, which the Chancellor and the Prime Minister are part of. And as I understand it, Mr Gove, when he had a similar problem a little while ago, suddenly also found himself part of a pilot. Now, these pilots are supposed to be random. Is there a Cabinet Minister who won't have the luck to be a subject in this pilot if he or she is pinged?
Well, this is a pilot, as I said, that's being piloted by around 20 organisations within the public sector, including Border Force, including Transport for London. It's correct that the Cabinet Office and Downing Street are part of the pilot. I'm not aware that other government departments are. It means that you can be tested every day in specialist asymptomatic testing centres, such as the one that's been set up in Downing Street. It means that the Prime Minister and the Chancellor will be able to conduct the most essential government meetings, but the rest of their time will have to be spent isolating and not, as I say, meeting up with family or friends or socialising in any other way. So it's relatively restricted.
Thank you for the...
I entirely appreciate your point, Trevor, that this isn't available yet to wider members of the public, and I appreciate the frustration that they might feel listening to this. They, like me or other members of the public who are pinged, will have to self-isolate in the usual way, and that's a really important part of our plan to keep COVID under control.
OK. I get that, and I appreciate you just said that if you were pinged, you'd have to self-isolate, but there's no evidence that that's what happens. You can see what it looks like. It looks like one rule for them and one rule for the rest of us.
Well, as I say, this is a pilot that's actually being used by around 20 organisations, so hundreds, if not thousands, of public sector staff who work in those organisations will be able to use this pilot. We'll be learning from it, and of course if it's possible to roll it out more broadly because it's proven to be safe and successful, then we will do. But for the rest of us who are not yet part of that pilot, the crucial advice is, if you are contacted by NHS Test and Trace, to take that very seriously and to self-isolate, because although it can be frustrating, that has helped us to prevent thousands of cases. A study from the end of last year showed that Test and Trace had prevented 600,000 cases and 8,000 unnecessary deaths in just a 3-month period leading up to the end of last year. So it is an important tool in our armoury to tackle the virus right now.
One last point on this, if I may. Do you happen to know who decided that Downing Street would be on that list?
No, I don't know, Trevor, but as I say, it is just one of several large organisations, some much larger, like Border Force and TfL, that employ many thousands of public sector employees. If the pilot is proven to be safe and successful, then I'm sure it will inform steps that will be available to the wider public. And remember, of course, that within 6 weeks, we do anticipate self-isolation changing. So in mid-August, the plan at the moment is that those people who are double vaccinated, and by then it will be the overwhelming majority of the population, won't need to self-isolate in the same way that they do today. And from tomorrow, the school bubble system will be retired. And so that will also make it easier for members of the public. I appreciate it's been very difficult, very challenging indeed for many schools in recent weeks, particularly the last fortnight, where the number of young people having to self-isolate as a result of bubbles and NHS Test and Trace has been considerable. That will improve from next week. We'll then go into the school holidays, and from mid-August we anticipate we'll be able to move forward for the double vaccinated to a different system.
I want to come to vaccination of children in a moment, but let's follow what you've just said. Last week, 500,000 people were pinged. Estimates out this morning suggest that up to 10 million people might be pinged in the coming weeks. Is what you've just told me that the government is clearly heading towards a situation in which fewer people are likely to be pinged, or that we might lift the self-isolation regime, for example, as the former Prime Minister Tony Blair suggests this morning, that people who are double jabbed would not have to self-isolate? Is that what's in prospect in next month?
Yes, it is. We've already said that we want to get to a point by the middle of August whereby those people who've been double vaccinated wouldn't have to self-isolate in the same way. They would take tests and have to follow all of the testing requirements, but they wouldn't need to self-isolate in the same way. And that will be a significant step forward. The reason that we've chosen to wait until mid-August is to ensure that we get even more people double vaccinated, because we know with the Delta variant that one vaccine is good protection, but 2 vaccines is very significantly better in preventing both transmission and serious illness and death. And so by waiting that extra 6 weeks, we should get to the point where a very significant number of additional people, particularly the younger people in their late teens and 20s who have been later to the vaccine programme, have been double vaccinated. Myself, for example, I've got my appointment next week to be getting my second vaccine, and so by waiting a bit longer we get much more of the population into that category. That is the decision that we've chosen to make. Obviously we'll keep that under review, but we expect by the middle of the month to be moving to a somewhat different system which will be less restrictive and easier for people to manage. But I do appreciate that this is proving to be very challenging, obviously for schools, although they are about to go into the school holidays, but particularly for businesses and public services across the country.
Everybody understands that the government is trying to make a judgment between the progress of vaccination and the speed of and variation in the virus, and it's a hard judgment to make. But let's test this out a little bit. Let's start with the issue of people who have been double jabbed, like the Health Secretary, who have now contracted COVID. What percentage of people currently in hospital with COVID have been double jabbed, do you know?
I don't have those figures, Trevor, but what the Health Secretary's case does highlight is the fact that although the current set of approved vaccines are very good at helping people to avoid serious illness and death, there's no full safe vaccine that can provide you with 100% protection. What the current vaccines do is ensure between 80 and 90% improvement in the likelihood of getting serious illness and even greater improvement in the likelihood of death. So they take what is otherwise a very nasty disease which can lead to serious illness and death and turn it into something that the overwhelming majority of us should be able to withstand. But they don't provide 100% protection, and that's why I say again, despite the fact we're moving into the next phase of the virus, and it's right to do so, we will need to do so with great caution, and each of us, particularly the most vulnerable, continue to show personal responsibility and judgment in protecting ourselves, our loved ones, and the wider public.
I get that, but let's just get clear on what basis you're making these judgments. Not very long ago on this programme, the former Health Secretary, Matthew Hancock, told us that the majority, or the vast majority, I think, overwhelming, I think is the word he used, majority of people who are hospitalised were not double jabbed. What he suggested to me was that actually being fully vaccinated provided pretty much complete protection against the virus recurring or being passed on. Is that still the case?
It is still the case. The being vaccinated with our current set of vaccines provides you, as I said earlier, with between 80 and 90% protection.
Still the case. Why not let people who are double jabbed be exempted from self-isolation?
I'm sorry, I didn't hear that question, Trevor. There's quite a lot of background noise here.
If what Mr. Hancock said is still the case, why are you not exempting people who are double jabbed from self-isolation? Given the economic and problems and the chaos, frankly, that the amount of pinging that's going to take place will cause this country.
Well, we've chosen to wait a short period, 6 weeks, on medical advice, which is to ensure that even more of the population get double vaccinated. That has two effects. Of course, there's a question of fairness, because that ensures that younger people can be double vaccinated before something is opened up to those who are more fortunate and have been able to be vaccinated sooner because they were older or more vulnerable. It also means that by having more people double vaccinated, transmission will be reduced within wider society, because of course a vaccine doesn't just protect yourself, it helps to a lesser extent, but nonetheless an important extent, to protect other people by reducing the risk of transmission. So it was a precautionary step, I appreciate that, but one that we took on the basis of the medical and scientific advice that by the middle of August we'd be in the position where a much larger number of individuals, particularly amongst those in their 20s who statistically are more likely to be out socialising, meeting other people more regularly, more of those individuals will be double vaccinated. I think that's the right thing to do, but I do appreciate that it will produce some further disruption and frustration in the coming weeks. But I would, again, urge people to ensure that they do have the NHS, the app on their phones, that it's fully switched on. We're seeing actually more people downloading the app than ever before, so the evidence is positive. But then if you do get contacted by Track and Trace, of course, to follow all the steps that are required, because it is a really important part of our toolkit for tackling the virus at this critical stage, as cases are still rising, hospitalizations are increasing, and we won't really expect this wave of the virus to peak until late August, maybe even early September. So there are going to be some quite challenging weeks ahead.
Mr. Jenrick, 2 points. First of all, you've been clear that actually there's a lot of stuff there are a lot of things we don't know and we can't be certain about, and everybody knows that. Secondly, you've used the word caution or precautionary, I think now half a dozen times. I've been noting it during this interview. Why are we still going ahead with Freedom Day tomorrow?
Well, as the Prime Minister said earlier in the week, there's no easy or straightforward answer to the question of when we should move forwards and move from a system of legal requirements to one of personal responsibility. But now does seem like the logical time. We're moving into the summer holidays for school, which will mean there'll be less transmission amongst young people and families. The weather is good. And so that is the most benign climate for tackling the virus. And we modelled what might happen if we were to delay for another short period, for example, till September. And there wasn't a compelling case to do so. So now does seem like the right time to move forwards. But we have to be honest with the public that cases are rising. As I say, we haven't yet reached the peak of this wave of infection. And so we all do need to approach this carefully and cautiously and in a gradual way. And we will all need to exercise good judgment. We are moving from that time where the state told you what to do, things were mandated as a matter of law, to one which had to come at some point where we trusted people, we trusted businesses and organisations and gave them the information they needed to make good judgments.
All right. Can I just be frank and say, I understand all of that, but I think that some people will feel that what you're really saying is that the government is essentially being blown by the course of events rather than having a plan. Now, there could be some very specific things that you could say we're definitely going to do. For example, you could decide, as have several other countries, United States and Israel, to vaccinate children. And that would make sure that we reduce the circulation of the virus and the possibility of more variants. Why not?
Well, firstly, Trevor, we do have a plan, and that plan, fortunately, is working. We set out that we would vaccinate by this point. In fact, we've done it earlier than we said we would do, 2/3 of the adult population with 2 jabs. We said that we would ensure every adult in the whole United Kingdom is offered
I just asked you about
at least
children.
1 jab. We've managed to achieve both of those two things.
Yeah, I've just asked you about children rather than adults. I wonder if you could deal with that.
Understood. Understood. Now that we have offered the jab to all adults, and of course there are still some that need to come forward, I'd strongly urge them to do so, we will be taking advice in the coming days from the JCVI. We haven't yet received their final advice on whether to extend the vaccine rollout to children. That seems like a sensible thing to do. And so we will be looking carefully at their advice when we receive it. We expect it very soon on whether or not we should open up the vaccine programme in the first instance to those children who are just short of their 18th birthday, to those children who have particular vulnerabilities, and those children who are in households where there are people who are particularly vulnerable. That seems like a sensible way for us to proceed, but ministers will need to make that decision when they're armed with the final advice from the JCVI, our expert advisors. And as I say, I expect that we will be receiving that advice very soon.
OK. Mr. Jenrick, before we finish, can I ask you to return to your normal position on the pitch in the team, and that is, as local government minister, you are one of the 2 secretaries of state responsible for social care. The Prime Minister said on the steps of Downing Street, on the moment he became Prime Minister, that the government had a plan prepared which it would reveal for social care. He will have hit 2 years as Prime Minister in the next few weeks. When are we going to see that plan that was prepared 2 years ago?
Well, the Prime Minister intends to honour that commitment. We've said that we're going to bring forward a plan before the end of the year, and I expect it will be published much sooner than that. We're working intensively on it. As Local Government Secretary, of course, I play a role in that, also the Health Secretary and the Chancellor. So you won't have to wait very much longer. As Local Government Secretary, I know how incredibly important it is that we put the financing of social care on a sustainable footing. It's been tested. very severely over the course of the last 15 months. People who work in the sector have done an absolutely magnificent job, as have local councils, in keeping it going. But now is the moment where we need to map out how we have a long-term, sustainable future for social care that protects the elderly and the most vulnerable in society and ensures that people do not have to lose their homes and that the people who work in the sector get looked after as well. So we will not have to wait very much for the Prime Minister to set out his proposals.
When you say before the end of the year, did you mean the end of the calendar year, which would be 2.5 years since the Prime Minister made his pledge, or before the end of this parliamentary year, the parliamentary recess, which at least would just be 2 years?
Well, Parliament goes into recess in a couple of days' time. We've said in the past that we would be bringing forward the proposals before the end of this calendar year, but I believe we will be in a position to set out proposals much sooner than that. But, Trevor, I'm afraid you just have to wait a little bit longer. All I can say to you is that all of us who are involved in this care very much about it. I think it's one of the most important generational issues that we have to tackle as a country, and we'll be publishing proposals soon.
Mr. Jenrick, thank you. You know what a patient person I am. Obviously, not everybody is as patient as me. We'll see when that plan arrives. Thank you very much for your time.
Thank you.